Ladies and gentlemen, it's devastating for any parent to lose their child. And if it happens due to medical negligence, the helplessness is traumatic, to say the least. In July this year, T-Series producer and former Bollywood actor Kishan Kumar lost his 20-year-old young daughter, Tishaa, to cancer. Now, this young girl was undergoing treatment in Germany. 4 months after their daughter's death, Tisha's mother and former actor Tanya has now revealed how the family got caught in a medical trap. She said that Tishaa never had cancer. Instead, she suffered from an autoimmune situation, which was wrongly diagnosed. Tanya said they did not at this time know of what the situation is. In her Instagram post, Tanya shared that at 15 and a half years of age, Tishaa was given a vaccine which possibly triggered an autoimmune situation, which was wrongly diagnosed. Their daughter had lymph node swellings. Their child. Tanya has also urged parents to go for a second and or third opinion. Now let's try and understand what has really happened in this case. On the broadcast, I'm joined by Dr. Prashant Mehta. He's an oncologist and senior consultant at Amrita Institute of Medical Sciences. I'm also joined by Dr. Ishwar Gilada, Infectious Diseases Expert and Secretary General, Organized Medicine Academic Guild. Good evening and namaskar to both of you. Dr. Prashant Mehta, let me begin with you and understand what has really happened in this entire unfortunate case. At what point and how can a serious and a grave disease as cancer be misdiagnosed?
So, first of all, my heartfelt condolences to the parents of the child, and really unfortunate if such a thing has happened. So there are a lot of disturbing things which have been said by the parents, which need to be really analyzed and looked into thoroughly. And so I do understand that there may have been a situation where there may have been some ambiguity or gray areas in a diagnosis or in science. In fact, science in itself has gray areas, and these gray areas are there in every science, actually, not even in medical science. And there are medical boards, tumor boards in the case of cancer diagnosis, tumor boards who discuss in detail a diagnosis and then finalize it, and the treatment is finalized. So autoimmune disease can sometimes be a very close mimicker of cancer, and cancer can be a mimicker of autoimmune disease. In fact, many cancers, they actually present itself with autoimmune manifestations. Many blood cancers, they have autoimmune manifestations. They can also have paraneoplastic manifestation, which means that the manifestations can be completely unrelated to the cancer, or the location of the cancer. So it's a very complex science. And science is ambiguous because nature has so much complexity, and there is so much of human limitations which exist, even even as of now in the modern era. And a diagnosis is established not only on a physical realm, on the clinical symptoms, signs, on the examination, but also now at the pathological, morphological, and immunohistochemical and molecular level. So we have got better with time on diagnostics, and most of the diagnostics are now very concrete and definitive, but still there can be gray areas. But these are generally
But can I
discussed.
understand from you, Dr.
Yeah.
Mehta, the mother
So
says that the
these
daughter
cannot be
had lymph node
yeah.
swellings. Uh,
These cannot be equated to medical malpractice or
yeah, that she had lymph node swellings, which can be misdiagnosed initially, but throughout the treatment that she got, could there never be any point where this was, realized that this is a misdiagnosis and something as disastrous as this has happened?
So it is very difficult to say based on this very Instagram post, or what the mother has said and stated or claimed. But if you go through the medical records and analyze what has transpired, what has been discussed by the medical treating team, a medical board, and a neutral board maybe. So all these facts can be brought out and can be discussed in detail. What she has written is actually very unclear, and it is not telling us much about what actually has happened with the child. So that is what I can say as of now, based on the very limited information which is there in that post, and what the parents and mother have said.
Hmm.
Yeah. But you
Dr.
asked me.
Ishwar Gilada, the mother has said that a vaccine was wrongly, given to the daughter, and then she developed lymph node swellings. What is the, frequency of that? Does that happen often? Why does it happen? I mean, there is so much technicality involved in it that we would like you to sort of simplify for us what must have happened there when a vaccine is given, which led to the eventual lymph node swellings.
Thank you very much for having me on the show. Basically, we must understand one thing, that we are having a media trial of a crime which we do not know whether there was a crime or not. Secondly, we do not know what vaccine she is talking about. Vaccines usually they are without much of a fatal side effects. Where vaccine can have adverse effects. No vaccine is without adverse effect, but the kind of fatal effects are not known. Only two vaccines are known to have some adverse effects which are of grave nature. One of them is a influenza vaccine, which was of a older time. Now, new influenza vaccines, they do not give rise Guillain-Barré syndrome, GB syndrome. The second vaccine which can give problem is a mumps and measles, which are usually given in children. They can give thrombocytopenia, where platelet count can go down. But firstly, it is not clear which vaccine was given. Secondly, it is not clear what kind of lymphadenopathy was there. Thirdly, it is not clear which cancer was there. There are multiple number of cancers. Dr. Mehta has excellently explained how the cancers are diagnosed and how we can go in this kind of situation. We fully empathize and sympathize with what has happened with this Tanya girl. But basically, when emotions take over the science, it is very difficult to explain. These kind of remedies are never found on Insta or any kind of social media post or even in this channel. They need to go to either medical council or Consumer Protection Act, or they should go for a BNS, Bharatiya Nyaya Sanhita, file a case. Now, 4 months are already passed.
Okay.
We do not know whether autopsy was done or not. We do not know which doctor treated. Whichever doctor diagnoses cancer, they will always double think, triple think, because whenever we label somebody with a terminal illness or a serious illness, double or triple opinions are taken amongst ourselves. But even for patient, it is open to take a second opinion. Thirdly, there's something called mens rea in forensic science. Mens rea means intention. What is the intention of a doctor to diagnose wrongly somebody cancer and treat with cancer drug? So I think it's very, very vague thing, vague allegation. I don't think such kind of allegation should be given any credence in media, in newspaper, because always newspaper and media want some masala. But doctors are very soft target.
I
Anybody can allege
absolutely
against
understand your
anybody.
point, Dr. Gilada, what you're saying. But at Mirror now, this is not a media trial that we're doing. We're just trying to clarify what the mother has said for our viewers because it concerns each one of us. And cancer is so commonplace that we need to clarify by experts like you and Dr. Mehta as to what could have happened and what the situation might have been. Dr. Prashant Mehta, she's also said that we did not take a second or a third opinion. Dr. Gilada said, of course, not just in cancer, but in a lot of other diseases also one must take second or third opinion. But in something as serious as cancer, how advisable is it to continue with one oncologist, to continue with one doctor, or, take a second or a third opinion and then move forward?
So in this situation, I gather from the literature, that they took treatment in Germany somewhere. And I believe they are residents of India, and the patient also was a resident of India. In that case, they must have met some doctor in India first, and then they must have consulted other doctors to go to Germany somewhere, because how do you reach Germany? Which doctor otherwise? So I believe that they may have been some opinions, I don't know, or maybe they started out treatment straight away in Germany, and the diagnosis was established in Germany. So it's very difficult to say, what has gone on actually, and maybe only, as I said, a medical board can look into it, and the grievances of the mother should be addressed. But a lot of it is not clear. Can you repeat your second question, which you said?
In terms of the second or a third opinion that the
Yeah,
mother has said that they did not take it at that point. So how advisable
they
would
did
it
not
be
take
in a
it.
case like cancer, in a disease like
Yeah.
cancer, to
So
continue with one doctor, with one oncologist who knows your medical history, or go to
yes.
different doctors for opinions?
So it is a good thing to take a second opinion, or maybe in some cases a third opinion. But when it comes to fourth, fifth, sixth, seventh, and eighth, then it becomes a mess, and the treatment gets delayed, and a lot of harm is done to the patient. Also, for a patient with cancer, and even complex diseases, like even some autoimmune diseases which are complex, there are non-cancerous conditions which are very complex and fatal, like autoimmune lymphoproliferative disease, or hemophagocytic lymphohistiocytosis, HLH. All these are not actually truly cancerous, but can be very much like cancer, and are treated sometimes with chemotherapy drugs, and as much toxic or intense treatment as cancer is treated. So it is okay to take a second opinion, and we should take a second opinion. I recommend it. In fact, doctors sometimes reach to their peer group to take a second opinion, third opinion amongst their peer group, and we do it very commonly in oncology, in medical oncology, and when we treat complex diseases. There is also an institutional tumor board in every cancer center which discusses a case thoroughly. So patient, and the patients I see, most of them, they do seek a second or third opinion, and they come back to me. And also, once you have taken a second, third opinion, it is better for a patient to stick to one center, stick to one medical team, because it has
Hmm.
been seen that the outcomes are better when you stick to a medical team and stick to the proper treatment, and a continuum of care is maintained. So that also matters with the treatment of a disease as complex as cancer. It is good to take a second opinion, and I also recommend that
Hmm.
it should be taken by everybody.
Hmm, hmm. Dr. Ishwar Gilada, can I understand from you, this girl, the young girl who lost her life, had lymph node swellings. If somebody does have that, does see it popping up on their body, what's the first few steps that one should take?
See, firstly, a lymph node swelling can be because of some infections like tuberculosis, infectious mononucleosis. We need to understand which area she had lymph node. Lymph node swelling can be there in plague, it can be there in HIV, it can be there in cancer. So, firstly, that. Secondly, whether she died of cancer, whether she died of chemotherapy, that needs to be established. Thirdly, when the cancer was diagnosed, Dr. Mehta also said about a peer kind of discussion in our group. But the first opinion is a clinical opinion, but second opinion is immediately histopathology, histochemistry. Without that, even a physician will not treat any kind of cancer patient, or a surgeon will not operate on a cancer patient. So basically,
Hmm,
all, and even during the operation, they take while patient is on the theater, they do immediate histochemistry, and opinion is taken again. So I think repeated opinions are taken. We need to really understand what has actually happened to this girl. Nobody want to lose such a girl at this level.
Yeah.
Secondly, for second opinion, even Tata Cancer Hospital in Mumbai, there was second opinion online. So they charge a very minimal, like 1,500 something. You put everything there, and second opinion comes. Thirdly, when your second opinion is given, the second opinion doctor also doesn't say that you come and take treatment for me. The doctor will say, okay, I concur with this opinion, or I differ with this opinion. Please go back to your physician.
hmm,
So
hmm.
basically,
Okay,
clear cut pathology in medical profession
okay.
is very easy for anybody to put a slur on medical profession, because they are very often soft targets. But in this condition, we need to understand actually what has happened. Rather than going on Insta and media, she should go to
Hmm,
any medical expert now also with a file and get an opinion. And people will get honest opinion. If you don't want, go to medical council. Even medical council will take opinion from medical board. So everywhere, even Consumer Protection Act, she goes, they
okay.
will take a medical opinion. Everywhere, medical opinion will be taken. Even in Bharatiya Nyaya Sanhita, she files a
Hmm,
criminal
hmm.
case, medical opinion will be taken. So medical opinion matters, and matter that
Sure,
can be
sure.
never on emotion. That will be only on the histopathology, diagnosis, clinical diagnosis, which lymph nodes were involved, how much they
Okay.
were involved, whether they were regular shape or irregular shape. Irregular can be cancer. So all these things are
Yeah, so
there,
the
and they can be
details need to be reviewed. Dr.
yeah.
Prashant Mehta, you wanted to come in?
Yeah. So I just want to tell you that it's a very important matter here, because always it has been thought that medical team and patient and family are opposing teams. They are not actually. They are one team. They are working towards patients' well-being. So whatever the family and the patients tell a
Hmm,
medical team, it should absolutely be heard and discussed. And the more it is discussed, sometimes families and patients come up with nice solutions. They take second opinions, and they sometimes they read up. So I encourage my patients to even Google. It's not a problem. So it's okay, because you have more hands, you have more eyes, more ears. So it's okay, the world is changing. And actually there should be no opposition between these two teams. They, when they combine together, I'm telling you, the outcomes are better always. So it is important that they
Okay.
befriend each other and they
Okay.
work as one team, not as opposing teams. The medical team and the
Yeah.
patient
Yeah.
family and their kin, they can be any number. We handle 20 relatives
Sure.
also these days, and we talk to
Yeah.
everybody.
Yeah.
No problem.
Yeah,
Shreya,
fair point.
I want to add
Absolutely
one thing.
important point. I'll have to wrap it up here. Dr.
Yeah.
Prashant Mehta and Dr. Ishwar Gilada. Yeah, yeah,
I wanted to add one
yeah.
point
Thank you so
that
much to
even
both of you. I have paucity of time. Yeah, yeah, sure. Okay, quickly go ahead, Dr.
I
Gilada.
quickly, no, but I wanted to say that even if doctors take a second opinion amongst themselves, they don't charge the patient. It's a free opinion. Any doctor talk to anywhere
Yes.
in the world, they give a free opinion. So I think this internal opinion also matters. Thank you.
Sure, sure. Okay. All right. On that note, I'll wrap it up here. Dr. Ishwar Gilada and Dr. Prashant Mehta, thank you very much to both of you gentlemen for joining us on Mirror Now and helping us understand and giving us a clarity on what might have happened and what cases there may have been. Thank you so much to both of you.
Thank you.
All right. With